Kia ora, and greetings from Walker Park in Auckland, New Zealand. My name is Tuariki Delamere. I'm a 68-year-old male New Zealander. As you can probably tell from my urostomy bag, I am a prostate bladder cancer survivor. Oh yes, and as you saw, I am a wannabe discus thrower shot putter. I've made this video for those of you who may be about to embark on the journey that I've undertaken for the past 12 months, which ended up with me in August 2019 getting a radical cystectomy, removal of the bladder, prostate, lymph nodes and sphincter. And so those of you who have just been diagnosed with an enlarged prostate, I hope this video proves useful, as it's from the point of view of the patient and not your white-coated surgeon. Okay, well, that's enough of me showing off with my discus throwing. Let me tell you what happened. May last year, happy as Larry, fit as, nothing going wrong, but not true actually. For the past year, I'd been having just little niggles with the waterworks. But like so many males, it's nothing big deal, I just ignore it. Well, finally, in May, I went to see my doctor. He sent me off to get an ultrasound, and the young lady came back and said, well, Mr. Delamere, you've got an enlarged prostate. And on my questioning, she confirmed, no, there's nothing else enlarged down there. Sorry, Mr. Delamere. Anyway, 6 days later, I'm in surgery for a TURP resectioning of the prostate. When I woke up, I had tubes flowing in, tubes flowing out, and through the haze of the anesthesia wearing off, I learned they'd found a tumor on my bladder. They'd taken that out and also resected the prostate and taken samples. So anyway, that's the start of my cancer journey. One thing I would say to you guys out there, you've got anything that's not quite working properly, hey, check with your doctor. Don't be an idiot like me and wait. I was lucky. I did actually get there in time. But gee, another 6 months later, I may not have been in time. So anyway, the results came back and yeah, I was confirmed both the prostate and the bladder were cancerous. Prostate, yeah, the type of cancer there, I'd probably die of old age in 20-30 years before I died of prostate cancer. However, the bladder tumor was very aggressive and there was indications. So we'll see, in June or July, I underwent a TURB-T and a transperineal biopsies. And I must admit, thank goodness I wasn't sure what transperineal biopsy meant, and normally I would go consult Dr. Google. I didn't this time, but I eventually found out what a transperineal biopsy was, and it's sticking up a needle between the rectum and the testicles. Thank God I didn't know about that till later. Anyway, they did that. And again, when I came around from that, the samples were sent off and came back, yep, the cancer I had of the bladder was very aggressive, etc., etc. And on August 14th, I had a radical cystectomy. That's where they removed the bladder, they removed the prostate, they removed the sphincter, they removed the lymph nodes. And they created an outlet from the urine. Obviously, once all that's gone, where the hell does urine go from the kidney? And it comes out through a stoma. They take a piece of the small intestine and fashion a tube arrangement to come out in the stomach roundabout here. That's what the bag's for. So anyway, got all over that. So what does it all mean? And of course, I never really understood what it meant. No one really sat down and explained it to me. So the first thing is, when you've had a radical cystectomy and everything comes out, you will have an exit point here on your stomach, on your abdomen, a stoma made from the small intestine, and the urine flows out from there. And you don't know when it's coming. It's not like before you can feel like, crap, I got to go to the toilet. You don't feel that. It just comes out when it's ready. And so you have a bag. Now mine's a Hollister bag, and yeah, I think it's brilliant. It's a wonderful piece of apparatus. The stoma fits in here, fills up 600 mils. You'll empty it several times during the day. And here's the exit point. Now, a couple points on that. It's got to be in that position while it's filling. When you want to empty it, you turn it that way, undo that, and you can empty it onto the toilet. With me, I just stand on the porch here because we have a farm and do it somewhere around the property, not a big deal. But that's 600 mils, and it works well. Change it twice a week, and it fits in through here. It's a bit of a pain. I'll show you later on in the shower segment. You can have a look at the shower segment. Now, at night time, this isn't enough at night, because during night you can end up having 2.5 liters. So at night time, we have the night bag, and this one here takes 2 liters. So, and you clip it on, you take this off, and you clip it on. Now, when you clip it on, don't forget to undo the tap so it flows out, okay? Because if you don't, you will have problems. Now, I'd wondered, what if I forget to empty my bag? Well, I found out one night, because I forgot to turn this thing off. The bag sort of blows up, and you wake up thinking, damn, it's hot tonight, really sweating, and yeah, it's not sweat. It's not the greatest thing in the world. But you're going to have accidents every now and then, okay? Now, the other thing, at night time, when it fills up in the morning, you empty it. So for me, again, I just wander out here and empty it on the farm. The toilet doesn't really matter. But you empty it here, get closer, you push that in, so you can see it comes out this way, it empties. Now, don't forget to push it back, okay? You can tell, you can see through the contraption there. Now, if you don't push it back, next night, you might have a problem on the floor. Did that once too. It does not win friends with your wife, or in case your husband, or whatever partner you have. So don't forget to shut it again after you've emptied the bloody thing. Now, for security, I always have my bag inside a plastic bucket just in case. Okay? So that's what you do. The other thing you need one of these. A fitted waterproof mattress cover. They're brilliant. Again, hopefully you never need it. But like I said, accidents happen, okay? You forget to turn the thing off or whatever, and it leaks. And also, the other thing, here at night time, this clips on really well. I mean, I think Hollis has done a brilliant job. Sometimes at night you can thrash around, you get caught up in here, and you pull this tubing off. The clip arrangement, if you see here, stays, but you pull the tube off. I've done that twice now. And again, each time I realized I'd done it, thank goodness, but even 5 seconds, you get urine comes out onto the bed. It's a pain in the ass. 2 o'clock in the morning, get up, take all the sheets off, okay? So, that's what that's all about. Next step is I will talk about the shower arrangement, okay? Next morning after the operation, I get to see the slice and dice incision and the stents going into the kidney coming out of the stoma. Anyway, let me tell you about how I change my urostomy bag. So get in the shower, take it off, put it into the disposal bag, then rinse off the area with the water. I go down and use just a body wash, and then I use that to shave around the area. And the reason to shave around the area is if you forget to do that, you know all about it at one stage when you remove the bag, because of the hair growth there comes out at the same time, and yeah, you don't want to get into that situation. Now what I do is then I dry around the area with a couple of paper towels. The first one, make sure it's as dry as possible. You got to keep an eye on it, because you never know when your stoma is going to leak. And if it does leak, you really need to start all over again, because you don't want urine splattered all over your body underneath the urostomy bag. So I hold the paper there until I take off the seals and push them in there at a slight angle. That's how I do it. But trouble this time taking that off. They're very good. And then remove the other one. And there we go. The seal is now totally complete. Okay, well that was the grotty part of what it looks like and what you need to do. A couple of other points. If you are traveling, my recommendation is take with you one of these, the urostomy bag, take a night bag, and take a spare waterproof sheet. Hasn't happened to me yet, and hopefully never will, but I can't imagine there'll be anything worse than staying in a hotel and having an accident with a urostomy bag in a hotel. I've started now, I travel a fair bit, and I always take these things with me. On a long flight, you just connect up the night bag just in case you fall asleep, which you sure as heck don't want your urostomy bag to sort of burst in mid-flight. Your neighbouring passengers probably wouldn't be too thrilled. On the matters of sexual function, yeah, it's going to affect you. How it affects you, a lot of it's up here. I guess being 68 and having 8 grandkids, it's not the same sort of stress that it would be, if you were in your 40s, for example. However, it is obviously a stress. The reality is the nerves that connect your brain down to your erection functionality sort of get somewhat destroyed in most cases in these operations. I know, I've read that doctors try to save the nerve, but in most cases it just doesn't work. And the solutions are, you can get big doses of Viagra, I guess. In many cases that won't work either. So the options for you are the injection in the base of the penis, or getting, I think, a metal implant or some sort of implant. Anyway, look, that's a discussion you have with your doctor, not for me. For me, I'm glad to be alive. I'm really lucky that my surgery caught the cancer before it got outside the bladder and didn't spread. So touch wood, I'll be competing in 32 years in the M100 Masters Athletics somewhere in the world. And in closing, I just want to thank all my surgeons, Andrew Williams, Simon Van Ree, Jason Du, the nurses and staff at Brightside Hospital, Mercy Hospital, and at 161 Gillies, and of course my GP Andrew Wong and his staff. Without them and without their support, I'd probably be singing a different tune. By and large, healthy and well, trying to get back to the same levels of strength and fitness I was a year ago. But my company motto is a Chinese saying, 不要放弃, and that means don't give up in English. And that's what I say to all of you out there, 不要放弃, don't give up, get going and do what you need to do. I hope that video has been useful.